Started the timer and here is the question.
Okay.
Right, so if you have read and understood, kindly begin your history-taking station.
Okay. Hello, I am Mohammed El Ayan, one of the exam candidate. May I confirm your name and age, please?
Hello, Ayan. I'm Mr. Smith. I'm 56-year-old.
Good.
Nice to meet you, Mr. Smith. Today, I have been asked to ask you a few questions regarding your condition. Are you okay?
Yes, please, go ahead.
How can I help you today?
Well, doctor, I have this sore throat that's been bothering me for the past 2 months. And I feel like there's something at the back of my throat.
I am sorry to hear that. Did it start suddenly or gradually?
Well, it started around 2 months ago. I noticed it, and it's starting to get irritating, becoming larger in size.
Did it come and go?
No, it was always there, but now I'm starting to feel a bit more uncomfortable. I have difficulty swallowing, and it hurts.
Anything that that lump increase in size?
Other than the increase in size, difficulty swallowing and pain as well. Yeah.
Anything that the lump decrease in size?
No, I didn't notice. No.
Have you noted change in your voice?
Maybe, I'm not sure.
How's your appetite?
I don't know. It feels okay, but I did lose a bit of weight.
Have you noted any intentional weight loss?
No, I haven't been trying to, but I did lose some weight.
Have you or your partner noted snoring during the sleeping?
Not that I know of, no.
Have you noted breathlessness?
No, sir.
Have you noted night fever?
No.
The swallowing is painful?
Yes, swallowing is a bit uncomfortable and painful sometimes.
Have you noted wheezy chest?
No.
Do you get breathlessness?
No.
Have you noted cough?
No.
Have you noted tummy pain or swelling in tummy?
No.
Have you abroad recently?
No.
Do you have any other medical condition like diabetes mellitus, hypertension, bronchial asthma?
No, I'm
epilepsy?
generally fit and well. I don't have any medical problems.
Do you have any surgery before?
Never. No.
Do you take any medication?
No.
What's your occupation?
I'm a teacher.
Who is at the home with you?
I live with my wife and kids.
Do you have any difficulty with the stairs?
No.
Do you smoke?
Yes.
How many packets per day?
1 packet per day for 10 years.
1 packet per day. Do you drink alcohol?
Yes.
How many units per week?
I drink 2 glasses of wine every day.
Regular or not irregular?
On a regular.
Anyone else in the family have the similar problem?
No.
What do you think the cause?
I'm not sure. I think like it's. I thought it was just a upper respiratory tract infection, and then it didn't disappear. So I'm not sure really. I'm starting to get worried.
What are you the most concerning about?
I'm not sure. I just want the pain and the discomfort to go away. That's all.
What are you hoping us to do for you?
Maybe examine me and let me know what's going on, because I've been to my GP and he asked me to come to you.
Chest pain or
No.
any muscle or joint? Anything else you want to add?
No, thank you, sir.
Thank you. Nice to meet you, Mr. Smith.
Can you present your history now?
Regard Mr. Smith, 56 years old, complain of the gradual growing of the right tonsil over the 2 months. Apparently lost 2 kilogram weight and have discomfort and swallowing. My professional diagnosis could be squamous cell carcinoma of the tonsil, could be glandular fever, could be tuberculosis, could be lymphoma, could be asymmetrical tonsil.
Okay, what should be the management of this patient?
The management after history and examination and the investigation can be done full blood count looking for the resident WBC for associated with infection.
Yes.
Urea and electrolyte looking for renal impairment if the patient is dehydrated because of decreased oral intake, and liver function test indicate glandular fever or metastasis. Can be done biopsy and examination under anesthesia and monospot test to detect the glandular fever, and band endoscopy to examine الفارينكس and the larynx and the upper trachea and the esophagus.
Okay, what should be the treatment for this patient?
The treatment after discussed in MDT meeting, the staging by MRI, neck and CT scan neck and ultrasound of the liver, block neck dissection, radical and modified radical and selective according to the structure involved, and the radiotherapy.
Very good, excellent. Well done. Just, yes, well within time, excellent, thank you. Yes, what they are saying?
Thank you, ma'am.
Yes, it's the first one.
Mohammed Radi.
Yes, thank you, Dr. Muhammad Radi. It was excellent. It was good. Both of you coordinated really well. And Dr. Muhammad, you asked the questions very nicely today, to the point. And he also answered you to the point, and it went very well within the given time. I'm really happy. Yes, Dr. Muhammad Al-Tahir is also happy. Everyone is happy. Anyone else want to give feedback to Dr. Muhammad Elian? Good one, yes. Dr. Muhammad Radi, how was your feelings when you were answering him?
I felt at ease, to be honest. He was very
Yes.
professional in the
Yes.
beginning. He gave me, there was sort of, I mean, if he was in front of me, I can imagine he would have, you know,
Yeah.
non-verbal cues, and he was
Yeah.
sorry about my pain and etc.
Yeah.
In terms of questions and the structure, he was very structured in his questioning. He went system by system.
Yes.
He notably ruled out cancer and asked
Yes.
about
Yes.
B symptoms, and asked about family history and
Yes.
drug and social history, which I
Yes.
think is good. Yeah,
Yes.
he did
Yes.
all right. Yeah,
Yeah, it was good. Yes.
yeah.
Thank you. Yes.
Thank you.
And the plus thing is that you felt comfortable answering him. So yeah, and he was empathetic as well. Yes, very good. So it was excellent. I'm happy, and I think others should be happy as well. So